Another type of synovial joint is the condyloid, also called ellipsoid joint. As we covered before, a condyle is a smooth, rounded surface. And in the condyloid synovial joint, we have a condyle, a smooth, rounded projection in a bone articulating with an elliptical shallow socket in another bone. And now you figured out why this joint is named condyloid or ellipsoid. An example of a condyloid joint is the radiocarpal joint. And obviously, the radiocarpal joint is between the radius bone and the carpal bones, specifically the scaphoid and the lunate. And as you can see, we have the elliptical shallow socket of the radius bone articulating with rounded smooth projections of the scaphoid and lunate carpal bones. And the same type of arrangement is seen between the metacarpals 2, 3, 4, and 5 and the phalanges. Consequently, another condyloid synovial joint example is the metacarpal phalangeal joint. Now, I have one more example of condyloid synovial joint, and this is the most obvious one. Look at this. We have here the mandible, and the mandible, as you learned, has the mandibular condyle right there, a rounded, smooth surface. And the mandibular condyle articulates with a depression in the temporal bone. And this depression is elliptical and it is relatively shallow. So it is an elliptical shallow socket. So what we are seeing here is the mandibular condyle of the mandible articulating with the mandibular fossa of the temporal bone. And clearly, this is an example of a condyloid or ellipsoid synovial joint. And how do you think this joint is named? This joint is named temporal mandibular joint. And when we look at the type of movements we can find, what we see is that we can flex and extend. If we're looking at the metacarpal phalangeal joint, for example, we can flex and extend our fingers, and we can also move it to the right and to the left, which would be called abduction and adduction. And this tells us that we have movements in two different directions. Consequently, the condyloid synovial joint is characterized by having biaxial movements, and as such, it falls into the category of a biaxial joint.